Everyone. Welcome to our June Core Kidney Conversation. My name is Evan Schneider. I'm a member of the Broombeans Health Club, and I'm the Outreach Director. This month's Core Kidney Conversation covers patient advocacy, support, and health policies. So, of course, as a reminder, all the information displayed within this Core Kidney Conversation is at your own risk, and we encourage you to talk to a medical provider before making any important changes. As always, we'd like to remind everyone about the Core Kidney program and the core values of clinical excellence, outreach, research, and education. And here is our circle of core. These are members of the community um, who have dedicated their lives to outreach and spreading awareness about kidney disease. Um, and here's all the members of our circle of core right here. And of course, we have our Broombeans Health Club. These are undergraduate students at UCLA who work with the Core Kidney program and Dr. Rastogi. Um, and currently, the club is comprised of 22 undergraduates. And we'd also like to celebrate our graduating seniors, especially our presidents, Simran and Rain, who are right here on the left-hand side, and our incoming board, right here on the right-hand side with our new presidents, Arv and Alicia. So without further ado, I would like to kick it off to Dr. Astogi, who will welcome our key speaker.
Thank you. Thank you, Evan. And I just wanted to just a shout out to our brewing beans who are just amazing and what a wonderful job all of you guys have done. I want to thank our um, outgoing emeritus presidents, Rain and Simran, and the board member and the incoming board members and presidents as well. And a special shout out to Christina, who keeps these things running. Now, as you might have seen, we have changed the title from Core Kidney Chat to Conversation. So this is our first quote unquote Core Kidney Conversations that we're going to have. And it's really my distinct pleasure, honor, privilege to have Miss Tiffany Jones Smith from Texas join us. And we met about a year and a half ago at one of the very big meetings, the KDIGO Genetics Conference. And I think we are just stars just aligned and our thought process was very similar. And one thing led to the other. And now Tiffany and I will be working, or Core Kidney for that matter, will be working together. But first of all, who is Tiffany Jones Smith? And she's going to share her own story, but I'm just going to read what we have on this slide. So Miss Jones Smith has served as a president and CEO of the Texas Kidney Foundation since 2017. She also serves as the chair of the Texas Chronic Kidney Disease Task Force and ad hoc member of the NIH, National Institute of Diabetes and Digestive and Kidney Diseases Advisory Council, which is, by the way, is our major NIH funding, federal funding for research that we do, so that the NIH. Her leadership comes from a deep personal history with kidney disease, having lost multiple family members with kidney disease, and is also a carrier for the ApoL1 genetic variant. And she brings lived experiences to her advocacy. So with that, I'm going to have Miss Tiffany Jones Smith come on and tell her more about herself and what an amazing person she is, but also the amazing work that she's doing in Texas. I will be going to Texas actually later this month to work with Tiffany. And our hope is that all the great stuff, the grassroots campaign that she's doing, the patient advocacy, kidney health awareness, early diagnosis, early intervention that she's doing in Texas, we bring it over to California. So with that, Tiffany, thank you so much for joining us. And I know how busy you are, especially with all the events coming up. So please tell us more about yourself and also the wonderful work that you've been doing.
Well, thank you for that great introduction. I need to keep you in my back pocket to go every place, every place together. The two of us, uh, are really kindred spirits when it comes down to kidney health and wanting to see people maintain their health and understand the kidney diseases that are affecting us. Um, so when you ask me to tell my story, really what I do so often is advocacy, but it's from a patient perspective, and it is because of having experienced the losses that go along with this. Um, but seeing the gaps, like for us, our team came into this looking at what existed and then what was needed. Um, and we saw a real need for systems change. So we approached the entire thing from a systems change perspective. But my personal experience was what uh, drove the tenacity behind it. Yes, this slide is of me, my younger brother, and my aunt and my grandmother. And so my younger brother uh, started losing his kidneys right around COVID-19, right before that. And I would say that the pivotal point for me, career wise, and as a human being, was we started losing people during COVID-19. And I didn't, it was, that was so unexpected, but we didn't understand underlying conditions, and everybody was learning at the same time. And I'm working with these world renowned doctors and wonderful people. Up until that point, the foundation was doing, good work, doing early detection of we were doing EGFR, testing the blood in underserved communities, and touching thousands of people every year, which is great, right? But that's just a drop in the bucket. Um, we knew policy needed to be changed, so we were working on policy too. There, it's multifaceted. But what catalyzed the situation and really put a sense of urgency on it was when we started losing people. We started losing staff members and uh, volunteers. And when it was all said and done, it was over 80 people. But about 14 people into it, um, I called a really good friend. Like, part of what I do is place other people's stories out front, because kidney disease isn't just one person. It's not me. There are many faces of kidney disease, of people that are families and individuals that are being affected by kidney diseases, and they're losing their kidney health before they even know it. And so I was working on that with a writer, and we were working with this one young man and Jamarcus Cruz. His sister and I have been friends for like 30 years. And so I called him to see how the story was coming. The story was with Lizzie Presser, and you can look that up because Lizzie wrote the story afterwards. But I called, and people don't generally not return my calls. Like, if I call somebody, most people return my calls. I always call and lead with value, so everybody returns my calls. And he didn't return my call, and I was like, "What's going on with him?" So I called his sister to see what was happening, and she informed me that he was in the hospital, and that he had called her and told her that he couldn't breathe on his own anymore, and he was essentially saying goodbye to her. He died the next week, and when that happened, it was right at the time when my younger brother had been uh, diagnosed with stage 5, and we knew that he was going into renal failure, and so it was all very real. Uh, and I thought, I was having conversations with people at high levels in this crisis that we were in, and I thought, okay, we're either going to go big or go home. And my husband we're all locked in our houses and we're listening to each other's conversations as they're doing, as I'm having talks with people and he's having talks with people in what he was doing. And I had one in particular, and after I got off the call, um, he turned to me and said, people aren't going to finance you to do this, because what you want to do is interrupting business, and it doesn't have a POC, doesn't have a proof of concept yet. But he was like, Tiffany, I believe in what you're doing, and I choose you, babe. I bet on you, babe. And so what I'm going to do is we're going to liquidate our 401k. We're going to build the infrastructure, because that's what he did. He built infrastructures and systems for a financial company, Merrill Lynch. So he worked with Merrill and brought his market to top 10 6 years in a row. So it's pretty good at it. And he was like, you're going to get 36 months of my time. So I'm going to liquidate our 401k. We're going to take part of it and build the infrastructure that you need to go into communities. And we're going to touch at least a third of the Texas counties. And that's going to give you a POC. And I said, okay. And that's exactly what we did. We were just like, he's a very, and so am I. We're just very much, you turn, nothing happens to you, everything happens for you. If something is going on that you are experiencing repeatedly, that is just seems like it's the most devastating thing, it is because you are the toughest person who can handle that thing. It's because you got it in you to take whatever that is and make lemonade out of those lemons. And so we built the first model with at-home test kits coupled with telemedicine to open up access to care. Telemedicine just really was a game changer for us during that. And when we did that, we talked to people about the model. But our thing was to get it into the hands of people. And so, and we didn't care who took credit for what. I don't care about credit. I care about that there's not another Tiffany sitting there with 17 people gone whose lives were hastened and didn't have to be. Because those 17 people have wives and kids, and everybody in their family is devastated and also afraid, especially when it's something that's genetic. And that often when we hear genetics, people think that's the end. So there's a fatalistic piece to that. So we knew that not only did people need to know about whatever was going on with them as early as possible, but we would have to change policy and we would have to prove that most underserved people would react to and act on what we were telling them. And so we did that. We had a 40% adherence rate. We just went for it to make sure that we pulled out all the stops. I mean, it was just like with you, Anjay. Execution matters, and who's walking into the space and presenting matters. I've met a lot of different doctors over the last 8 years. A lot. I've seen a lot of programs. I've looked at programs because I do nothing but this. When you lose that many people, one of the things that happens is it gets quiet. Another thing that happens is that you are unwilling to let it go, and you only want to bring the best to the people that you serve, the very best, which is why I stalked Anjay to Chicago. um, and watched this program, beautiful program, Core Kidney, because I believe that it is in the young investigators. It's in guidance from seasoned investigators like Anjay. But the most important piece that exists with Anjay is his sincere, genuine love for every patient he deals with. Difficult, not difficult, he has a love for people, which means that he has a high bar for what his expectations are for those who are working with people around him. But he has the most tender heart to go along with that. Of all of the people that we've seen, he is the only one that I have seen that I was like, move everything around, get him over here. Because this is someone who will definitely be leading and is leading. The rest of the country just doesn't know it yet. He's leading the revolution in healthcare and bringing the care back to healthcare. That, to me, is probably the most important piece of Core Kidney, along with these wonderful students. So when I saw him and finally got to sit down and talk to him, I mean, that was what I led with, was like, hey, let's work together. I want to talk to you about this because a lot of what we do, we based it on uh, translational research. And when you start looking at the translational research on work in community, and there are several names that come up over and over again. Don Wesson was one of them. So we got together with Don Wesson and actually worked with Don on our program. There were some wonderful papers that led us in development by the NIH. We just worked with at the time, they had an AMKD lab, which is the rare kidney disease that I have, APOL1 mediated kidney disease. It didn't have a name when we first started working with it. It was just APOL1, and everybody referred to it as Apollo because that's what the studies were called. But we really just hunkered down on translational research, ignored the pain of what we were going through, and used that as a catalyst to push us towards actual action. Because it doesn't matter if I'm telling you my sad story, and yes, it can be viewed as definitely a very upsetting story. But it won't mean a hill of beans if we don't take action and change things so that you don't have that sad story. So, that pretty much sums up why, I guess, a high level view of why I do what I do.
So, Tiffany, first of all, thank you so much for the kind words. And I think you're right. And my beans will tell you, Christina will tell you, she has higher standard than I do, actually. But, but it's very important. And the term that we discussed was empathy, and not sympathy. But what
Mhm.
struck me about you, Tiffany, because we had multiple conversations, and that's why I'm so excited to join you in your efforts in Austin, which is happening later this month. Ideas are simple um, most of the time, and but it's the execution that's really becomes and what you have done. I mean, we definitely would like to speak more about what you have done with the governor, with all the stuff that you're doing about screening. I mean, this is really about early, and we said that, and I quote those numbers all the time. 1 in 3 are at risk. 1 in 7 have kidney disease.
Mhm.
That's 37 million adults have kidney disease, but only 1 in 10 know that. So 9 in 10 don't know. And by the time they come to us as nephrologists, it's a bit late to really preserve their kidney function. And what struck me about you is about early diagnosis, early intervention. And we talk about that, but how are we going to move the needle? And one point that I do want to point out over here is about kidney health screening. So we always do say this at risk people should be screened for kidney health. And at risk people are diabetes, hypertension, cardiovascular disease, obesity, lupus, all known factors. But the problem is, a lot of stuff that you're focusing on, Tiffany, don't have those risk factors. The people that you're showing me in this picture don't have those risk factors. And I think that's what you're trying to push. It's a universal health screening. It's checking for the kidneys, but also checking for genetic diseases because we saw Nanette over here, and PKD. She's a big advocate for polycystic kidney disease. So what we have found out that 1 in 5, so up to 20% of patients with kidney disease have a genetic cause.
That's right.
20%. That's that's a very high number. And UCLA has been, I'm sorry?
We call genetic kidney disease rare kidney
Yeah.
disease. It's not quite so rare, is it, when it's one
It,
in five?
and also it's not rare if you have it, right? Because look at
Mhm.
the picture over here, Tiffany. I mean, how many people in your own family are affected? So I think what we need to do, what you are doing, um, is approaching it from different angles. You're going to NIH, right, which is the main
Mhm.
funder, federal funder. You're going to the governor, right, and his team.
That's right.
So getting their buy-in, and then I'll be doing the screening for you at the church the next day. So we're going to the church. So I think it's a 360, involvement of everybody. And
That's
and
right.
I think
And
that's
it's a
how we're going to move
policy
it.
change.
It's the
You
policy. Yeah.
it doesn't matter if Andre wants to do everything right by patients. If you're not within a system that allows you to do that, you can't. And your hospital can't. The hospital can decide we want to provide free early detection
Yeah.
screening to everybody. We want to provide universal screening to everyone that wants to opt in for it.
Mhm.
The hospital can't do that because of the way that the IDC codes are written. Because of there has to be policy change
Mhm.
that supports the hospitals, the doctors, and the patient. This is not a problem that is, when I said we look at the system, it's a systems problem that we have here. It's not simply that patients don't care or doctors don't. You can do to make money with and work less than you work as a doctor.
Yep.
You know, so I don't know anybody that got into being a doctor to everybody that I know that's a doctor did it because it is a calling. It's something that they feel in their souls, their hearts, that they want to do. And so you know, we've got to set this system right
Hmm.
so that everybody can do what they're trying to do, make people better, help people keep the quality of life and the health that they have,
Hmm.
walk folks through the mental health side of this. I mean, to have to to try to bifurcate. First of all, kidney disease is bifurcated in how it's treated.
Hmm.
Those early stages are treated with, most of the time, with the primary care physician, and they don't know a lot about kidney disease in general, and certainly very little about genetics because
Hmm.
it's such a new field. And so much is being demanded of primary care physicians and primary care practitioners. So you're dealing with a lot that has to happen policy wise.
Hmm.
Otherwise, how are you guys going to make it? And that was what caused us to say, let's work on this task force.
Yep.
Let's work on the recommendations, because if you can make recommendations to the governor, if you can get the governor of Texas, one of the most conservative states in the country, to support kidney health and mental health, you can move every state in the nation,
Hmm.
because as Texas goes, so too goes the rest of the United States.
Can't agree more with that. Yep.
You know, that is a statement that we make all the time to our constituents, because we're the eighth largest economy in the world.
Yeah.
When we move stuff, we can move the entire world, you know. And so it's not uh, it has not been an easy task, like getting the political support.
Yeah.
Um, but it's a bipartisan issue. There's kidney disease doesn't know a party.
Right.
Kidney disease is something that everybody's dealing with. There's every single person knows somebody
Right.
that has a comorbidity, or something that leads to this.
Hmm.
And helping them to understand that the kidneys stand. Uh, Kidney disease is not necessarily related to those top four comorbidities. It's not always diabetes, hypertension, cardiovascular disease, and obesity. There are other factors that we're looking at that, you know, we don't understand all of it. So you can't just fold it into something else.
Right.
It's something that has to be studied by itself. Well, you got to deal with policymakers to help them
Yeah.
understand that.
And I think that's really, I think what we need to, that's our next phase of core kidney, Tiffany. We
Hmm.
obviously have people, Nanette will be speaking and Sonu as well, but also Surabhi, our Bruin Bean, who has her own health, and she spoke at the last chat, and wonderful. But how do we pass bills? Um, as you said, now one thing I can tell you, core kidney, wouldn't be here if we didn't have the support from our healthcare system, and you will meet her someday. Our president of UCLA Health is Joni Spizzo, who's just an amazing person and has really been, as much as she can, support the core kidney. And Dr. Mazziota, who's our vice chancellor for the entire healthcare system. So buy-in from the leadership is very important, but like also explaining to them in numbers. I think the patient's voice is so important. We have so many patients joining us today. It's really important to speak up. Um, and like I said, our goal at the end is early diagnosis, early treatment, and hopefully prevention from happening. Now, that cannot happen with genetic diseases because you have a mutation, but all the other things. So this is where Texas and California will join forces and really move the needle and do whatever we can. I mean, only time will show what we can achieve, but at least we're trying our best. I
I believe there's a lot that can be achieved because I think healthcare systems, and as you look at it, it's evident that healthcare systems want healthy people. They
yes,
are trying for healthy people. It is we're not incentivizing that.
yeah.
So systems are not compensated for that. So that means that the overall, when we're dealing with policy, when you set policy so that it matches what we're saying.
Hmm.
So if we're saying to healthcare systems, hey, we want everybody to be healthier. You all make everybody healthier. Okay, well, the IDC codes have to match that. You've got to be compensated for making people healthier.
Hmm.
And you've got to get people to want to come and see you for that.
Sure.
There's the trust factor that has to be built, and that's a beautiful thing that Core Kidney does a good
Yeah.
job of, is building that trust factor back up,
No.
because there's a mistrust
Yeah.
of healthcare, um, that right now I just think that there's a lot of healthcare professionals that are doing a great job, and there's room to build those bridges, but
Mhm.
you have to have the right people again in the execution of doing that, and that's where Core Kidney and Texas Kidney Foundation really shine.
Yep. Yep. So, Surbi, do you have any questions for Tiffany or comments?
Yeah, thank you so much for such an in-depth explanation. I think one thing I'm wondering is how do you recommend like developing those relationships with people who can make changes like senators and assembly people, especially like when you don't already have those contacts?
I didn't have any of those contacts when we first started. Well, I had a few contacts, but um, you go see them, tell them your story, and what has now, that's where your story can come in, is when you go and see them, but have your legislation that you want to start with. Like, we set a 5-year plan. It was one of the first things that, when I came into the foundation, we had $13,000 and 11,000 in expenses against it, so there was nowhere to go but up. But we did not have anything together legislatively, and nobody wanted to deal with policy. They were like, "Oh, this is too hard. Policy is hard." Like, talking to these people, is you don't know who you're dealing with. It's landmines, um, and we developed a committee to do that. Looked at, okay, what do we want to happen in the next 5 years? Because often we overestimate what we can do in 1 year and underestimate what we can do in 5 years. So, I got everybody in a room and we brainstormed and had a professional come in and work with us on what we, some exercises on pulling out of each person what their perspectives were and how we could move forward, what we wanted to do in moving forward legislatively. Then we put the directives together and began with, okay, well, what's the low-hanging fruit? Meaning, what can we have an impact with immediately? You know, in the next immediately being the next legislative session. In Texas, we meet every 2 years. So we had time to develop what that was going to be. And then going after that, well, as luck would have it, we had Winter Storm Uri come through. Winter Storm Uri, I'm sure you all saw that.
Mhm.
And Texas was on its own legislative grid. This was where I probably really won my legislative chops in Texas. Besides the things that we've done nationally with other organizations, but in Texas, where I won mine, and you know, something like this is undoubtedly may happen where you are. When Winter Storm Uri happened, we immediately we were getting calls from people crying in hospitals, you know, and I had all the phones moved over so that they were coming to one of the work cell phones. So I'm getting these calls. I'm getting the calls. It's not the staff or the answering service. I'm getting them, and I'm sitting there listening to this and listening to people trying to get to their relatives. And I was really blessed that my lights and stuff were on. They were going on and off. So afterwards, we get to the other side of it, you know, and we're going we went through the brownouts, them telling us we were having brownouts, but we knew that there was more going on. And I'm talking to the emergency response networks across the state and realizing that the ESRD network was not a part of what they were doing, like what ERCOT was doing, which was the group that was responsible for energy. They certainly should have had ESRD network as a part of what they were of any emergency responses they were having. So we do that. We go through this, and in like a week or two after the lights and stuff come back on, ERCOT is having a meeting, and they have all of us. They let people get on the meeting. I'm sitting on this meeting. I'm listening to what they're saying, and I didn't like the attitude or tone that was being used, because it was just it was very transactional and not sensitive at all to the people that had gone through, who had lost family members and stuff during that time. When that happened, I was like, you know, we need generators in the dialysis units all across Texas. Every dialysis unit should have generators. And we had 758 dialysis clinics at the time. So they were running a $4 billion bill. $4 billion. And dialysis wasn't on it. So I started showing up at everybody's doorstep, everybody's office. I want dialysis on this. It's $4 billion. And held out until they put it on there. And went to see, and I mean every doggone body that thought they had something to do with that mess. Because I told them on the call when they were being rude, I said, because they wouldn't let us talk, we could only chat. And I sent a little message in the chat, and I said, you are going to change this attitude towards the human beings and the people in this great state. And if you think you're not, you're talking to the wrong lady. I got off the call and went to Austin and was like, fix this. Now, Andre, you said, Tiffany, do you ever get mad? Yes. That made me mad. And I was just like, I am all for being independent. I'm a Texan through and through. But if you're going to be independent and say you're your own island, you better be able to take care of everybody on the island, which is what I said on that call. And I'm going to make doggone sure you do it. And don't think that you're going to get away from me because I'm holding your feet to the fire. Unless God Himself takes me home, you're going to fix this. And just hunker down. Now, that's me. You don't have to be quite so intense. But this is Texas and it requires a big response to big problems. That's always, now that's me.
Yeah.
So I would say, channel that into whatever it is you want to do.
Right.
But when things come up, respond to it.
Yeah.
Don't that little feeling that you have, hey, I'd like to do this. Don't ignore it. Everybody else will tell you, no, sir, we don't do that. We always do it this way. Anytime somebody tells you we always do it this way, you definitely do what you were thinking, which is the opposite. Definitely do that.
Yeah. I think this is great advice to Surabhi. And I can tell you she's a go-getter. So I think she's going to follow your path, Tiffany.
Well, when
Yeah,
I
thank you so
heard
much for the
Sylvie's
input.
story, I heard a leader and a visionary. That's what I heard. A young leader and a young visionary. And where is Sylvie going to be when she's 30?
Thank you. I really appreciate that. That's very kind of you, and advice is really helpful. And I'm really excited to see what happens in Texas once Dr. Rastogi is able to come as well. And I'm really excited for that.
Me too. I told Dr. Rastogi we're going to change the world together.
Yep. Yep.
They just don't know it yet.
So Sonu, any comments from you for Tiffany?
Hi, Tiffany. This is Sonu. I've been a patient of Dr. Rastogi for a very long time, and I can vouch for everything you said and more. He has been an amazing doctor, and he is a source of great hope for me personally and for my whole family. And I don't have enough words to express my gratitude towards him and towards you of whatever you are standing up for. What you just explained and what just you shared with us is a great example of hope in action. What you're doing is giving hope to patients. It's amazing. You're showing us a path how to bring about how to move things. We all do it in our own little ways. One of the things I'm passionate about right now is giving voice to the patients in terms of where they can communicate with their doctors about their needs. Usually people I mean, all the resources are given to them. What if the patients could ask themselves? And there are a few things that I have in mind. One of the things I like to do is I teach, I have developed some curriculum for the fifth graders and where I talk about listening to your bodies. And there is one day where I actually go and make them listen to their hearts and their body sounds. What that does is it helps them understand that the body talks to you. And when your body is talking to you, you better listen to it. because that gives you clues.
Mm-hmm.
And then another thing is when students are actually listening and they understand some of the, when we have little programs in the schools, in the middle schools, in the high schools, they would be better, even before they have the disease, they are better prepared to make better choices. So when Dr. Rastogi is talking about prevention, we need to bring awareness at that level. And this comes personally from my own experience, because there were times when I could see my mother having diabetes and I did not know, though, I mean, I was reading it in school, polyphagia, polydipsia, and other things. I could see it, but I did not have enough courage to connect the two and tell her to go to the doctor. You know, children can be great ambassadors because we can teach them. So if the parents are not educated, you can go via that route. Another thing is about hope. When you said about what you said about hope, is we tell them that hope is not just a good feeling, it is action, like you did. Just take the next stop, a next step. There are options available, what Dr. Rastogi is doing. And the other thing is develop a framework where the patient is able to identify that, okay, I just got diagnosed in this. What are my resources? What are the things I need? How can I get the best resources available? How do I ask for help? How do I give back? And things like that. And I've come up with my own framework which needs to be verified. And someday I hope to verify that and have that tool available from the patient's perspective, not from the doctor's perspective. Thank you.
Yeah. So Sonu, just before Tiffany has any comments, it's interesting you said that about teaching the kids so they can become the advocates. Now, your son Soham, one of our superstar Bruin Beans, used to come with you and
Yes.
Ahmed, when he was very young. But you were obviously highly educated yourself. I mean, you're a healthcare professional yourself, and but it's interesting saying that, especially for the underserved community, a lot of times they really don't have the time. But if you educate the kids, they can be actually advocates for the parents. Actually,
Yes.
that's very powerful. So thank you for sharing that. Tiffany, any comments on what Sonu said or?
Well, I fully agree with what you're saying, Sonia, because that's what we're based on is the patient perspective, um, and building an implementation arm to do exactly that, provide the thing that we didn't have, which was early detection of our disease. But we also believe the same thing, that educating the whole family is the key to really disease mitigation. Whenever you're talking to a state and whenever you're talking about policy, it's always going to boil down to numbers. It's going to boil down to numbers from their perspective. And so explaining to people uh, the cost savings, the savings to that family,
Mhm.
and just breaking that generational problem of whatever it may be that's contributing to this, especially if it's diabetes, cardiovascular disease. There are some things that you can do that are within your control, in what you're eating, what your, you know, movement, that can be helpful. And I love what you said about listening to your body and really engaging with your professionals, and hope. You know,
Right.
we have a program called the Hope Program. It's helping our people empower, and part of empowerment is knowledge. You have to understand what it is that you have and what are the options, because most people have no idea what their options are, that there are resources, options out there. There are SGLT2 inhibitors. There are new innovative drugs. Filspari is a great example of that. There are all kinds of options that the average person has no idea about. And then there are treatments. There are so many things that you have within your control that you can do. But you have to work with a medical professional to help you figure out what your plan's going to be. But you can make a plan, and nothing can beat a person with a plan. If you have a plan, you can shake the world up. I'm a great example of that. And I'm not the one who comes up with all the plans. We've got a whole team of people that come up with plans. I'm just the one that's always out there talking. I'm the one with the biggest mouth out of all of us.
Yeah. I quickly wanted to just share this hope ladder that I have created. So it says you do not jump out of a problem, you climb out of it one step at a time.
Oh,
You name the feeling, you plan it, one small step, and you keep going. And my
Right.
hope sentence is preserve your function till the next help arrives.
Mm, mm.
you need to publish that, Sonu. Like make something so the beans can put that out there. Like put it on a t-shirt or something. Make because that is great. I love that.
Yeah.
Thank you.
No, she has a book published already, multiple books, right? So,
No, just one book that I'm working on. Yes.
no, thank you.
Well, I
And
want to read your book.
oh yes, we'll send you a copy, Sonu, and
Yeah,
actually,
definitely.
I'll take it when I go and see her.
Yeah.
Nanette, do you want anything to say about mental health really quick? Because we're running on time now, a few minutes left. Yeah.
That's right. Yeah. Mhm.
And Nanette, your husband, Rick, a neuropsychologist, I mean, he wrote that book. What a powerful book that is. And so I think, yeah, yeah. And I think, this, meeting of minds is so important. And everybody who's on the call and is attending, be a part of this, you know, every single thing, small thing as you might think it is, it's not small, as like what Nanette said and Sonu said and Surbi and obviously Tiffany, you're planting a seed, get the word out. it has to be a grassroots campaign. The patients' voices need to be heard. And that's what all this is about. That and who has the biggest stake in the game? The patient does. So I'm a very big believer that if you're going to make any changes, it has to be at the grassroots. And that's our patients all working together. What Tiffany is doing, what Nanette is doing, Sonu is doing, Surbi and Brewing Beans and Christina and the Core Kidney, the Texas Kidney Foundation. And there are a lot of like-minded people. Once they come together, it becomes a movement. And I think this is what this is about. And that's why I'm so much looking forward to visiting Tiffany and her wonderful team in Texas and working with them and doing these screenings and stuff. So Tiffany,
And
I think
yes, that's right.
and and then they have finals and they're still here. That's that's that yeah.
You
And
know,
yeah, sorry, go ahead, Nanette.
no, I was just going to say, Dr. Rastogi, there is a light inside you that attracts people.
Yeah.
And I mean, light attracts light. Like I feel like I just met my new closest friends on this. Just listening, you just brought. I mean, Nanette, we got to talk when we get off of this. We got to talk, lady. But you just bring out enthusiasm in people. You do. Because my husband heard me talking to you and he was like, "Who are you talking to?" All excited. That's Dr. Rastogi. You know, he was like, "You just sounded," he loves hearing me happy. You know, I mean, you do that. You do that. So never discount yourself. Never discount yourself because you are the glue that's holding all of the rest of us together. And you're that intellectual piece along with the heart piece. And I know that the scientific world doesn't care about the heart piece, but man, that's what's been missing, and you're what's been missing. So I just adore you, and we are going to change the world together,
We
all
are.
of us
And
on
I just
this.
want to do a shout out to Christina, one kidney.
That's right.
And I just want to say Christina has been really the glue as well. I mean, she's and yeah, yeah, she's yeah. And now with Tiffany joining us, Nanette, I think changes are going to happen. I'm very excited, very hopeful. Um, and so let's do it, Tiffany. You know, you
Okay, let me do that because I will be happy to join you.
and you can see the wonderful beans.
I've got to meet the beans in person. I told our team we got to meet the beans in person.
They want to meet you in person, Tiffany. They they won't leave you alone. So thank you so much, Tiffany. Thank you, everybody. Thank you, Nanette. I know you were driving. Sonu, I know you weren't feeling well. You still joined. And everybody else, our beans, they're here, even though they have their finals, but they still made time. So thank you so much, Tiffany. Really appreciate everything. And I really look forward to, we have a lot to do between today and June 26th, but
Yes,
but we'll get there. We'll get there.
yes, yes.
Okay. Thank you.
Thank you. Thank you for having me.
Thank you, Tiffany. And thank you, everybody. We'll see you